If you recently become eligible for Medicare, you may be surprised by some of the costs that you're required to pay, particularly to avoid any penalties. Now, in some cases, you may qualify for special programs that can help reduce your costs. One particular program I want to talk about today is what's known as Extra Help. And this program is there to help you pay for your Part D prescription medication costs. If you do qualify for the Extra Help program, then this would help you pay for your Part D premiums, lower deductibles, and coinsurance or copayments. In some cases, depending on your income, you may have no costs whatsoever for your Part D plan. As far as your copayments and coinsurance, there is a maximum amount that you would pay for medications. In 2022, the max is $3.95 for any generic medication and $9.85 for any name brand medication. There are two main criteria to determine if you would qualify for the Extra Help program. One is based upon your income, and the other is based upon your resources. In 2022, as a single person, you can have up to $20,385 in yearly income, and for a married couple, it would be $27,465. So if your income is at or below that, then that would be qualifying income. Then for your resources as a single person, you can have no more than $15,510 in resources, and for a married couple, it'd be $30,950. Now the question is, what are resources? So this is where it gets pretty specific. I'll go through this here to make sure you fully understand what resources are considered and which ones are not. Resources that do count would be any money in a checking or savings account, any stocks, or any bonds. Resources that would not count towards your maximum would be your primary home, one car, a burial plot, as well as up to $1,500 that you may have set aside for burial expenses, any furniture that you own, or any other household and personal items. Again, these do not contribute towards your maximum resource limit. When applying for the Extra Help program, you may also want to apply for the Medicare Savings Program as well, as that program may be able to help you save some money on your Part B premiums. Some do automatically qualify for the Extra Help program. For example, if you already have Medicare and you have full Medicaid coverage, then you would automatically qualify for the Extra Help program. Or if you have any help paying for your Part B premium from your state Medicaid program, then you would also qualify. And last, if you're receiving supplemental Social Security income or SSI, then you would qualify for the Extra Help program automatically. Now, if you don't automatically qualify and you meet the income and the resource limits, then you can apply for the Extra Help program anytime during the year. And while you're applying for Extra Help, you may also want to apply for the Medicare Savings Program as well, as that might help you also save on your Part B premiums. Since these programs are based upon your income and your resources, it's important to check this every year to make sure that you're still within the limits for your income and resources and avoid any penalties or having to pay back any premiums that were not supposed to be covered by the program. If you've paid for prescriptions since you were qualified for the Extra Help program and you're not enrolled in Medicare drug coverage, be sure to save your receipts, as you may be able to get reimbursed for those expenses. If you think that you qualify for the Extra Help program and have any questions about getting enrolled, be sure to add a comment below, or you can email me directly. My email is in the description, along with a link to my calendar. There you can set up a free 30-minute consultation to speak with me one-on-one about your particular needs. If there's anything that you'd like to hear more about in future videos, be sure to let me know. I always appreciate those suggestions. And be sure to check out any of my other content on this channel, where I go more in depth on specific topics about Medicare, as well as other insurance products. I appreciate you viewing today, and thanks for watching. If you found the information in this video helpful, you know what to do.